Hi everyone, today we're going to be doing an elbow and toes. So we'll go over this first. First thing I want you to do, sir, is go ahead and put your arm out on the table for me. Perfect, just like that. Do me a favor, go ahead and scoot your butt back just a little bit. Perfect. I'm going to pick you up here, lift up just a little bit for me. Alright, you can drop your elbow. Alright, so there's a couple things to keep in mind whenever doing this projection. Number one is your SID is going to be about 40 inches, so somewhere in the ballpark of this. You're going to center directly on the elbow joint, and then, let's see here, you want to make sure that the palm is up directly. You want to collimate down to about, nothing too crazy, but just a couple inches on each side. I think 8 by 10 is what's usually recommended. On this, we always mark laterally, don't put it in soft tissue. And then the biggest thing to keep in mind when doing this projection is you want the whole arm and shoulder in the same plane. So in terms of that, you want to make sure the humerus is flat when sitting on the table and not like kind of droop down or anything like that. So there you go. There's our AP. Beep. Thank you, sir. Now next thing I'm going to need you to do here is I want you to go ahead and lift your right shoulder, let your left shoulder kind of drop, rotate outwards, perfect, just like that. Go ahead and pick your arm up for me real quick. There you go, you can set it back down. Left marker, same thing, 40 inches here, centered on the elbow joint. And the thing that we're really looking for, you can go ahead and rest. I know it's not comfortable. So the thing we're really looking for on this projection is to free the radius, head, neck, and tuberosity, free of superimposition of the ulna. And always mark laterally and try not to get it in the soft tissue. Now, sir, for the next thing I'm going to need you to do is just place your elbow flat on the table like this for me. There you go, perfect. And rotate your thumb up. Good job. You go ahead and set your arm back down now. This thing, we want to be sure to mark anterior on this. A big thing to notice as well is that the thumb is up. On the AP projection, we want the condyles to be technically perpendicular to the central ray or parallel with the IR. In this scenario, we want the condyles to be technically, perpendicular to the IR and parallel to the central ray this time. Little confusing there, I know. So, same thing again, 40 inches about here, centered on the elbow joint. You mark anterior on this projection. Big thing to keep in mind is just the thumb up. Keep your hand straight for me. There you go, perfect, just like that. And then go ahead and scoot your butt back in the chair for me as well. There you go. We want to make sure we're in the same plane here. Make sure that the humerus is flat on the table. All right, we're all done with that. All right, so big thing to keep in mind, again, we mark laterally here. And then we are also at 40 inches again, but we want a cephalic angle, and we're centered on the third MTP here on the toe. The reason we angle cephalically, and again that's toward the head, is to open the joint spaces within the toes. And then obviously you'd collimate down just enough, maybe include about half of the metatarsals. And yeah, we're just looking for open joint spaces on this projection. Now as for the oblique, I've never done an oblique toes before, but the biggest thing to keep in mind is the degree of the foot needs to be internally rotated at about 30 to 45 degrees. So, y'all good here? All right, so roll your leg in just a little bit for me. Keep going, that's probably good right there. Hold that just there for me. No angle on this one, 40 SID again. There you go. I don't really know why I'm showing that with the flashlight, but the biggest thing to keep in mind is 30 to 45 degrees with the foot, not necessarily the knee, because the knee and the foot can be out of line. And we're just looking to see unequal concavity on the toes. All right, you can go ahead and put your foot down, there you go. I'm gonna need your foot up there for one more. There you go, and just let your knee fall all the way out towards me. Like this? Yeah, there you go, like that. Your foot up here. So normally we would use like a tongue depressor or something like that, but let's just say it's a second toe, so I'm gonna have to wiggle in here. I know it's painful, sir. Just Kind of flexes under there like that. Alright, well, this isn't going to work as well with a pin. Normally we have a tongue depressor, so that works a little bit better. But basically we're just trying to get his second toe here to pop outwards. And then we always want to make sure we mark laterally anterior. Again, 40 inches SID on this projection. We're centered at about the third metatarsal. The biggest thing to keep in mind here is you just want to make sure your foot is in true lateral. So rotate up just a little, down a little for me. There you go, just like that. Collimate in enough just to include the whole foot. And make sure it's all in true lateral. And that is all the projections for today. Thanks for watching.